Good morning, my name is Johnny Hernandez Perez, and this is my presentation on ions critical to human health for Dr. Terry Villareal for Chemistry 101 Introduction to General Organic and Biochemistry for Grand Canyon University. Now, the human body is pretty dependent on several ions in order to maintain its good health. They play a lot of roles in the body, including metabolic reactions, muscle contraction, neurotransmission, and hormone regulation. And we'll start this off by talking about sodium. Now, sodium has a simple chemical formula of Na, and it is generally a silvery white soft metal, and it usually exists as a cation with 11 protons. Now, many foods do not naturally contain sodium, but no surprise, many processed foods such as bread, pizza, sandwiches, and savory snacks have high amounts of sodium in them. Now, the function that sodium plays, it plays a vital role in voltage-gated channels for action potentials and neurotransmission. And you can see down here some of the roles it plays, with it playing a part in this voltage-gated channel and setting a gradient to be able to do that action potential for muscle contraction and, in some cases, also neurotransmission. So the daily recommended intake for sodium is a general consensus of 5 grams per day, which is very easy to meet, especially if you are eating those processed foods that we just talked about. When this requirement is not met, hyponatremia can occur. And these are some of the symptoms of hyponatremia. Same over here. Some of the symptoms include feeling weak, feeling tired, cramps, nausea, dizziness, changes in personality, low blood pressure, feeling nauseous or inducing vomiting, seizures, and if it goes on long enough and it is severe enough, it can actually lead to shock and coma. Now, hyponatremia prevalence rates are different around the world. One study had Saudi Arabia reporting 11.1% of their elderly patients suffering from hyponatremia, while 8% of Italians and 3.37% of Chinese patients went to the ER for the same thing. Some of the recommendations to be able to counteract hyponatremia are reducing the water intake, treating underlying causes that could be causing the hyponatremia, and stopping certain medications that could also be contributing to the hyponatremia in the patient. Now, the next ion we're going to talk about is iron. Now, some of the properties of iron: it is a grayish transition metal cation that can exist as either iron 2, so it will be iron 2 plus, or iron 3, iron 3 plus. Some of the dietary sources for iron are your classics like red meat, seafood, nuts, beans, dark leafy greens, and this one is especially enjoyable, your dark chocolate. Now, the function of iron is that it helps bind oxygen to transport it to the rest of your body. This is why when you go in to donate blood, and I know this from experience from my time working at a blood bank, this is why they check your iron. If it is too low, and we start taking more blood out of your body, it could lead to the donor passing out, and nobody wants that. Now, the daily recommended intake for iron is pretty low, only 18 milligrams per day. When your iron is low, it can lead to iron-induced anemia. Anemia affects about 1.2 billion people worldwide, so it is a pretty prevalent condition. Some of the symptoms of anemia can include tiredness, weakness, pale skin, dizziness, and headache. And over here you can see a few more symptoms of anemia, which include yellowish skin, some jaundice, cold hands and feet, shortness of breath, irregular heartbeats, chest pain, and fatigue. These will all make sense since the body will not be receiving as much oxygen as what it should be, and this is what it can lead to. Now, some of the more common treatments for anemia include eating some of those iron-rich foods that we just talked about, cooking in an iron cast skillet, and taking iron supplements. We actually used to give these out at my last job at the blood bank. And one of the a little bit of a fun fact, if you take iron supplements or trying to absorb that iron better, if you drink orange juice, it'll actually help you absorb it better. This is a trick we used to give to people all the time because the vitamin C, if I'm not mistaken, helps your body absorb it better. But you want to avoid calcium because that can actually mess with your iron intake. Now, the next ion we're going to talk about is oxygen. Now, oxygen is a group 16 anion that exists as gas in the form of O2. You can see it down here. These are your two oxygen molecules with their double bond. Now, there's no really dietary source of oxygen because oxygen is in the air that we breathe in every day. Now, the function of oxygen is that it plays a role in cellular respiration. It is the final acceptor in the electron respiratory chain, which you can see down here. Here are your two ions, here are your two electrons, and here's your oxygen. And all together they combine to form the byproduct of water, H2O. So it plays a very important role in cellular respiration. As far as the daily recommended intake, obviously there's really no recommended daily intake since we breathe in oxygen all the time and we will die very quickly without it. Now, the lack of oxygen for whatever reason, whether it be disease, a thinner atmosphere when mountain climbing, lack of oxygen due to choking, whatever, this is referred to as hypoxia. Now, symptoms of hypoxia can include restlessness, confusion, cyanosis, which is where your skin starts to turn blue, rapid heart rate, as well as over here is rapid breathing, tachypnea, rapid heart rate, tachycardia, anxiety, difficulty breathing, dyspnea, confusion, which I already said over here. And severe hypoxia can lead to slow heart rate, extreme restlessness, and once again, cyanosis. Now, the prevalence of hypoxia has changed in recent years due to the recent COVID-19 pandemic, with up to 65% of COVID-19 patients showing signs of happy hypoxia. Happy hypoxia is a condition where the body is not getting the oxygen it needs, but the patient is also not showing labored breathing. Now, there are several treatments to treat the shortness of breath or hypoxia. Some of these can include medications that open up airways, such as albuterol, which I have had to use on somebody before, and what that does is it opens up the bronchioles to better receive the oxygen. Machines to treat sleep apnea, and obviously you have your classics such as CPAP machines. And what we've all often seen, whether in hospitals or out in public, supplemental oxygen tanks. Now, the last ion that we're going to talk about is bicarbonate. Now, bicarbonate is a polyatomic ion with a chemical structure of HCO with 3 oxygen and a negative charge. Now, bicarbonate can be a byproduct of the metabolic reactions in the body, but it can also be found with other molecules, such as potassium bicarbonate, which it can be found in fruits and vegetables, and sodium bicarbonate, which can be found in baked goods. Now, the function of bicarbonate, it plays several roles in the body. It can play a role as a pH regulator. It can control the activity and stability of dissolved proteins, and it can affect the membrane potential by going through anion channels. Right here we have the chemical formula of bicarbonate, and right here we have examples of some of its functions. Right here we can see that it is playing a role in maintaining the pH. Right here it is playing a role in cell maturation, and over here we can see that it is playing a role in controlled proliferation of this T cell. Now, the daily recommended intake of bicarbonate. This was a bit more complicated to find information for, because bicarbonate is usually accompanied with another molecule, such as that potassium bicarbonate and that sodium bicarbonate that we talked about. Most intake recommendations are based on that particular compound. Most sources only give information about dosages for already existing conditions, such as, well, the condition that we're about to talk about right now. Now, the result of bicarbonate deficiency is known as metabolic acidosis. Some of the symptoms of metabolic acidosis include a faster heart rate, so once again tachycardia, confusion, and fatigue. But over here we can see more symptoms that can result from metabolic acidosis, including needing to take deeper, longer breaths, frequently sighing, having difficulty swallowing. Over here we can see low blood pressure, low body temperature, dry skin, brittle nails, lack of appetite, nausea, lack of energy, depression, etc. Now, metabolic acidosis is especially prevalent in patients who have chronic kidney disease, or CKD. About 15 to 19% of CKD patients suffer from metabolic acidosis. Now, one treatment of metabolic acidosis is the prescription of sodium bicarbonate, and obviously the actual chemical, not by eating baked goods. The sodium bicarbonate would help out by balancing out that pH, which that is what acidosis is. The body is too acidic, or the pH is too low, and the sodium bicarbonate, since it plays a role in helping balance that out, it would help out with that in that way. The dosage of the actual sodium bicarbonate is based on the severity of the condition and on the age of the patient. As was seen, ions can play a very important role in maintaining the good health of the body. Without the presence of several of these ions, we have seen that severe symptoms and severe sickness can occur, which can eventually lead to the death of the patient. Even though we only covered 4 ions in this presentation and on the paper, there are many, many more, such as potassium, that also play a vital role in maintaining the good health of the body. Thank you for your time in watching this presentation, and have a good day.